Um, Lovely to see you all this morning. It's really good to know that I've got some Scottish colleagues here as well, including some people who have been working with me to try and see how we can support people coming out of hospital or care facilities to keep walking after they've had that intensive experience. So it really ties in my work recently very well with the ambitions of green walking. I'm a landscape architect, so coming from a very different background, but my work in open space at the University of Edinburgh very much brings together understanding of the physical environment, particularly the outdoor and the natural, and people's health and well-being in recent years. I'm going to give you rather a dash through research, and apologies that I can't explain the detail of all that I'm going to show you, but I wanted to give you a flavour of the evidence that supports the benefits of getting access to green and natural environments. And you can follow, you'll get access to the slides afterwards. You can follow up on any of this afterwards if you want. I'm very happy to give more details later. Just to say that there are two reports that I was involved in contributing to, which give a lot of the evidence if you want an easy way to look them up. The WHO European Region Report of 2016 on urban green spaces and health. I contributed to the review of evidence there. And then more recently in 2017, they produced a review of interventions to try and enhance urban green space to improve health. So those aren't obviously completely up to date now, but there's a lot of good material there if you want to look up particular references. One of the things that I wanted to underline was the fact that the Sustainable Development Goals that the UN has developed very much align with the World Health Organization's goals. And in fact, the World Health Organization sees these Sustainable Development Goals as the best way to get better public health. So if we look, for example, at linking good health and well-being to sustainable cities and communities and life on land, then just one sub-goal of sustainable cities and communities is about providing access to safe, inclusive and accessible green and public spaces. And in particular for women, children, older persons, persons with disabilities, actually we all need this, and coronavirus has just underlined how important good local access to these places are for us all. And there's nothing new in this. I teach landscape architecture history, and it turns out that for hundreds, if not thousands of years, people living in urban environments have understood the virtue of having a bit of greenery, even in the town, Rus in urbe. The ancient Romans promoted the countryside in the town. The 18th century public park movement, which Britain prides itself on having been a pioneer of, was very much promoted around the idea that particularly working class people living in dense urban areas needed access to green space for their health. And the public park developed, for example, in Birkenhead, very famously outside Liverpool, was seen as an opportunity to promote healthier living for people working in the mills of Liverpool and the docks and urban areas there. These wonderful quotes that you can see on the screen are focused on the cleaner air, among other things that would be available in the parks in very polluted urban environments. But there was also an interest in mental health. And this quote from Frederick Law Olmsted, who worked with an English architect, Calvert Vaux, to develop Central Park in New York City, among a number of famous parks in the United States. He was very interested in the mental benefits of getting into green and natural environments that evoked what he called rural scenery. And you can see this quote here actually resonates very much with the difficulties of urban living and the stress of urban living today. And he saw these rural style parks as a very important part of psychological benefit, not just physiological benefit. And much more recent research, and I can't cite you all the quotes, but I've given you some references earlier, just reinforce the fact that green and blue space including water, beaches, lakes, riversides, is salutogenic, is health enhancing. And whether we look at mortality or indeed morbidity, there are many different studies across the world now which demonstrate that, other things being equal, having better access to green space is likely to be associated with better well-being. But we see this particularly true for more deprived communities. And so it's also been suggested that green space is equigenic, that the difference in health between the most economically deprived people and those better off is enhanced if they also have access to good green space. And this nice chart produced by my colleague Rich Mitchell, with whom I worked on the Green Health Project a few years ago in Scotland, but this is a survey across a number of European countries, showing that, as we all know, there is a relationship between general health or mental health and your socioeconomic status. And the black line shows people who have great difficulty with accessing green environments near home. And the dark green line is those who have very easy access. And you can see that, excuse me, this is leveling off that imbalance. It's equigenic. Having more green space near home makes that mental well-being, gives people with socioeconomic deprivation a better chance of supporting their well-being. There are a number of mechanisms that have been proposed to explain what this relationship is and how it works. Physiological responses, psychoneuroendocrine mechanisms, the immune system, parasympathetic nerve activity, a whole range of very interesting research findings. But we also know that physical activity is the most popular thing that people do when they're outdoors in green and natural environments. Even if they also stop and have a picnic or something, they are most likely to be doing at least some walking when they're out and about, if they can walk at all in a natural landscape. And we know, therefore, that physical activity is good for our cardiovascular health, but it's also good for our mood and our stress. And another study here looked at, does having physical activity in a natural environment enhance your health more than doing the same level of physical activity in a built or indoor one? And the answer is yes, it does, very significantly. Again, a study by Rich Mitchell as part of a larger project we were engaged with. So if you're going to be physically active, being physically active outdoors in a natural environment is going to enhance your mental health more than doing the same thing indoors. Those psychophysiological responses that we see in the body turn out to be very important and influence both physical and mental health. And in a study we did looking at, excuse me, green spaces, how much green space people in very deprived urban populations, people out of work, had, the access they had to green space near their home, we could predict healthier patterns of cortisol, indicative of the whole sort of psychoneuroendocrine functioning by the amount of green space around their home. What does this experience mean? Here are some quotes from people that we worked with in the Forestry Commission that very much talk about, you're not in consumption mode, you can get away from it all, you can calm yourself down. People clearly found getting into natural environments very therapeutic when we interviewed them. We've talked to older people, and not surprisingly, at all ages, we find a benefit in getting outdoors, whatever age we are. It's stimulating, it's a good, getting away from it all is often a phrase that people use. We also discovered that people have very vivid memories of their childhood. Even if they're teenagers, they're nostalgic for their childhood. Particular moments in green space or green environments that were very supportive. And there is a lot of research which suggests that having had that good access to green and natural environments in childhood becomes a resource that you can then draw on later on in life. So there is a challenge for those people who have not had good access to green space in childhood. It's harder for them to access that resource or understand the benefits that they might get from it. A study by a colleague, Jenny Rowe, working on her PhD, looked at forest schools and showed that a forest setting was particularly advantageous to young people with behavioural problems who'd been excluded from mainstream schooling, and a range of beneficial outcomes compared with a conventional school setting. And these young people with behavioural problems benefited more than young people without behavioural problems. We did a study which you can also access very easily online for Natural England, looking at wild adventure space in teenagers' lives. We talked to some teenagers in very deprived urban communities. They told us that there were important things about getting out in a natural environment. They felt very unwelcome in many public spaces. A natural environment is one where they might be able to do what they want, be how they want to be, talk to their friends in the way they want to. Freedom was important, but they also felt that they needed support from trained youth workers or other support because they didn't feel able to access these environments and enjoy them on their own. They didn't feel empowered to do that. And just to finish with touching on some very recent research looking at older people's engagement with the natural environment, mobility, mood and place. Some very pioneering research which has received a lot of attention from journalists, where we had used a mobile EEG system to measure neural waves while people were out and about in busy streets or green spaces. Very briefly, we showed that access to green space seems to buffer the response to the demand on attention that a busy urban environment needs, and can also be a very restorative place if you've moved from a busy urban environment where you have to pay attention. Particularly in old age, we often find that having to look out for traffic, look out for other people, different noises coming in, having perhaps less stable footing, can all be very unnerving, and a green space allows that attention that is demanded to be restored and enables us to cope better after that. And finally, we looked at people's access to green space over their lifetime in a cohort of people now in their 80s. We looked at where they had lived throughout their lives in the Edinburgh and Lothian region and how near they were to green space. And we found that for mental well-being, we saw a relationship between anxiety and depression limited to the most socially disadvantaged neighbourhoods, but green space during childhood makes a difference significantly to anxiety and depression in older age. Anxiety every decade of life near more green space made a difference in older age. So a really important message about the need for nearby good access for everyone, but particularly for our mental as well as our physical health. I'll stop there, happy to answer more questions later.